can see we have thousands of old women and young children here that have come all day. They've been here since morning, looking for an opportunity to be able to see a physician.
It's very, very important because we are besetted with all types of illnesses. So during the years that you have been coming, people have benefited from that.
To be able to do this tonight, and then, as you said, it could be just infectious, especially since it's oozing, and it may be pus. If it's pus, then it's infectious that caused this, in lymph node to be enlarged. And if it's not, then it could be cancer. Okay, but it looks bad, but this may not be cancer. That may be the blessing. All right.
I've been seeing both pediatric and adult, acute problems mostly. One of the good things is that the symptoms or the problems that I have encountered, we do have medications to treat, and I'm excited about that. So then we can help. And even the few problems that I perceive where surgery was needed, we do have surgeons on site, and then we get full assistance.
My name is David Valentine. I'm from Houston, Texas, and I'm with Living Word under Dr. Paul Canning. And I just wanted to tell you, we came here with a vision to help, and the need is great. The need is greater than anything we thought. We have way more people than we can serve today, and it takes the life out of you to not be able to do what these folks need done. But what I'm asking you to do is to commit with me to do better next year, to help, to push, to put forth our funds. These are people that look like us. These are our people, and we got to do better. We thought we could get it done here, but the need is much, much greater than we thought.
Surgery, we did a right inguinal hernia repair on this young man. We did it with spinal anesthetic. Dr. Smith did an excellent spinal anesthetic.
Thank you.
The patient was laughing through the operation. We did a mesh repair, which is a very specialized, instead of just putting stitches in, we put an artificial mesh, which is a much better and much stronger repair.
And as you see, he's awake and talking to you. I would say wave, but his hands are to his side. But you did well, right? And he laughed through the procedure. Yeah, no problem.
Is there anything you want to say to Living Hope team that came and did this surgery for you?
I'm so grateful for the whole team, for the ministry having the opportunity to come down to Soweto to help people like us who doesn't have money to go to hospital. So I said that God should bless them.
Conferences, because there are so many pastors out there who have the desire and the zeal to minister to the people over there, but because they're not trained and they don't have the resources and they're just struggling. So the Lord has also led it in our hearts to begin to conduct conferences and pastor seminars in order to equip them so they can be able to reach the people that they are trying to reach. Very young man who, for the past 5 months, has had an insect bite or something that happened that triggered this condition. And I know 3 years ago, I think it was 3 years ago, when we first saw him complaining of, there was a little, I think it was a bite, some insect bite. And we started treating it 3 years ago. And today we can see that there's a lot of improvement. The plan and the vision is to be able to have a medical clinic out there where we'll be going every year and just taking care of people, and where we'll have people to come and just have a continued medical attention that they will be receiving. So that's one of the things that we plan on doing.
what we give is gone in a month. And we frequently can make a difference for these people, but it's a month's worth of difference, and they have a condition that lasts all the time. I am hoping that we will develop a clinic where my wife and I can come and stay year-round and maintain the care of everybody all the time.
So I want to challenge those of you who are watching this tape to consider how you can be involved in helping Living Hope. It may be simply by praying. If you do nothing else, God could use your prayers. But for some of you, God wants you to do more than pray. God wants you to consider how to use your gifts to come to a community like this and offer your hands and your resources to support Dr. Acho and his ministry.
I plead with you to please come and help and be a part of this ministry. This is a great ministry. It is run by Dr. Sonny Acho, and he has been coming here for 10 years to give back to his community. And I plead with you today that if you could just please make a donation of any kind, whether it's prayer, whether it's pharmaceutical medicines, whether it's sending someone, sponsoring someone, it would be greatly, greatly appreciated.
It's a great need, and we will need you to either come, if you have the skills or have the heart to come and help us minister to people, to please come. Or if you have the funds or the finances to help, to pray and let the Lord lead you in doing whatever you can do to help us.